From their state-of-the-art mobile vet hospital,
Put a little mask on your face for some oxygen.
this dedicated wildlife rescue team is delivering care to thousands of native Aussie animals,
You're in good hands, Daryl.
saving lives
Hello, big thing.
no matter what their size.
It is too precious.
And in this episode of Wildlife Rescue Australia,
Okay, little one.
He's got this huge tear in his pouch.
this pelican needs surgery.
They will hold their breath during an anaesthetic procedure.
So Dr. Shoni has a huge job ahead of her.
He's not breathing on his own, which is nerve-wracking.
Hello, gorgeous.
Crash the baby bandicoot needs a checkup.
So he's still very, very young, so we've got to be very careful and gentle with him.
But Dr. Bree isn't happy.
Bandicoots are known for getting a condition called bloat. I'm hoping he doesn't have that.
And Franklin, the eastern long-necked turtle,
So he's gotten good at keeping these feet inside now.
doesn't want to play.
This could take a while.
What's going on, dude?
This is Wildlife Rescue Australia.
Miss Lou, do you mind coming down and helping me with this bandicoot?
The long-nosed bandicoot is a nocturnal marsupial found all over eastern Australia. It's omnivorous and lives in rainforests and grassy woodlands, foraging at night for insects such as beetles, grubs and caterpillars, fungi and plants. Long-nosed bandicoots are solitary for most of the year. The gestation period is one of the shortest of any mammal, at just 12.5 days. Baby long-nosed bandicoots spend only 2 months in their mother's pouch before being weaned. And today, a baby long-nosed bandicoot has come in to the Byron Bay Wildlife Hospital after being caught in a cat trap by mistake.
Looks like he might have some little injuries from the cat trap, so I want to have a look over him. Unfortunately, its mum got accidentally trapped in a cat trap, and when they've gone to release the mum, she has run out, and poor Crash has got dropped when the mum has run off, so he's now been orphaned. So he's very little.
Oh, he's so
he
cute.
definitely would be still with his mum. So you can see that he doesn't have his eyes open yet, but his ears are sitting up, but his mouth is still sort of quite early in its development. He's getting a few little teeth through. So he's still very, very young, so we've got to be very careful and gentle with him. But I thought if you could help me hold him and we'll have a look over him.
Yep.
So he's a long-nosed bandicoot, which is quite common in the area up here in the Northern Rivers. And they can dig and they can kind of look like rodents because they have that long nose. And so people will sometimes try to catch them thinking that it is a rat. So unfortunately, this guy's been an accidental bycatch, I would say, for whatever the people were trying to catch at home. He's got a little wound on his nose and a little wound on his shoulder that I can kind of see. So we don't want any bacteria or sort of bugs getting in there. So the quicker we can clean it, the better. Hello, gorgeous. I'm sorry. So I'm just going to give this a little bit of a clean with some really dilute iodine. We don't want to irritate the tissue. Ouchies.
Oh, he's trying to nuzzle me. Must be hungry.
He's like, are you my mum? Will you be my mum?
Of course.
So at this age, you know, he's really nice and active, which is really good. But he's at that stage where he could go either way. This doesn't look too bad. Hello. I reckon that's going to heal. We can put some little cream on there just to make it feel nice. And that nose is just a scratch. Let me have a listen to you. So with our smaller patients, I use a paediatric stethoscope so it doesn't look so big on them and I can hear everything. So his heart sounds really good. I can't hear any crackles on his lungs, so that's a good sign. And then I'm just going to have a look at his belly. And so I'm just seeing if there's any like gut sounds or anything that sounds weird, but there's not. You're doing so well, little one. You can see his ears there's no fur really on him, so we can see there's no blood in his ears, which is a really good sign. We're also going to give him some fluids, and so we're going to give him a little bit of glucose and just some rehydration fluids just to make him feel a bit better. And these will just absorb over the next hour or so. Just give him a bit of energy. Done. But I think he's one very lucky bandicoot, and hopefully he will grow up to be released.
He's super cute. Very sad that he got separated from his mum, though, at such a young age.
This bandicoot, even though it's very little, it's kind of on the cusp. And if it doesn't have any serious injuries, that makes the prognosis better for rehab and release. So these wounds are quite superficial, so I'm happy for it to go into care and see if they can make him grow up to be big and strong.
So just putting him in his little pouch, similar to what he would be in, like, his mother's pouch.
And then we wrap him all up because his mum would keep him nice and warm. We want to get him snuggled away as quick as possible. Even though he's cute, we don't want to have him out for too long. And we've got Maddie, one of our really great wildlife carers, coming to pick him up soon. He has to be started on some milk. He has to be kept in a pouch of a certain temperature. And she's just going to monitor those wounds to make sure that nothing sort of goes on with them. All right, go well, little one. But we will get him in for a recheck in a week or so to make sure that everything's going okay.
Hello.
Here you go, here's your next baby.
Oh, okay. All right, mister.
Australian Seabird Rescue has brought Ollie the pelican to the Wildlife Hospital.
He's just watching me get nailed by this pelican now.
He has a big tear in his pouch,
Ouch.
which is a massive problem for Ollie. The Australian pelican's bill is sensitive and helps it find fish in murky water. They use their pouch like a net, plunging their bill into the water and drawing up fish. Once the pelican has caught some food, it draws its pouch up to its breast, allowing the water to empty out. Once emptied, it manipulates the prey into a swallowing position, with the head facing down the throat, and then with a toss of its head, the pelican swallows the prey. When fully extended, the pelican's pouch can hold up to 13 litres.
So most people would know a pelican's big long beak with a big pouch underneath their beak that they use for feeding purposes. So with Ollie, he's got this huge tear in his pouch, and you can imagine this is really going to affect the way he feeds, and if he can't feed, then he's going to starve to death. Hey, mister. Hey, mister. So today we're going to give Ollie a general anaesthetic. It's all right, friend. And then we're going to clean up the wound and then go ahead and suture this wound closed. So I'm about to give this pelican a sedation. We're going to use some Valium, wait for that to slowly take effect. It's fairly straightforward. They're easy to handle.
You've jinxed it now. The pelican just got really snappy with me.
5 or 10 minutes, he should be a little bit quieter. That enables us to handle him a bit easier. It reduces the stress on the animal and just allows for a calmer whole anaesthetic process. Good boy.
That anaesthetic process involves putting Ollie to sleep using a swab soaked in a liquid sedative.
Pop it in his pouch and he will just breathe off that vapour.
The next part is not quite as simple.
So we're just going to place an endotracheal tube into his larynx and then attach him to the anaesthetic machine. He's fighting it a little bit and sometimes they can hold their breath.
They are tricky buggers.
You're breathing on his own, Hayley?
Not yet, no.
So they will at times hold their breath during an anaesthetic procedure, and that's when we have the nurses assist the pelicans to breathe by giving them a forced breath from the anaesthetic machine.
Do we know what caused the tear in his pouch?
I have no idea, but it maybe got a fish hook stuck and then it's torn through the pouch.
The surgery will be delicate and is expected to last up to 3 hours.
You ready for me to start?
Yep.
And Dr. Shani will begin by cutting away the dead tissue.
This tissue along the edge here is scar tissue and it has no purpose. It needs to be taken away. There was quite a large amount of tissue that had to be debrided or removed from the edges of the wound, and trying to match the edges up was quite difficult. So I'm going to try and suture it back together again. Hopefully we can match it all up. And the way we suture up a pelican's pouch is we suture the outer layer of the pouch and also the inner layer of the pouch, and that enables it to have a nice tight seal.
The massive tear in his pouch means Ollie will receive up to 80 sutures.
One stitch, just like the other one.
A lengthy procedure which could see complications for our big bird.
He's not breathing on his own. I'm going to give him some adrenaline.
Yeah, that's his heartbeat that we can hear.
So it's
through
still a
the
little bit
Doppler.
low.
Pretty low.
Yeah.
So just gave the pelican some atropine. We're just wanting to get his heart rate up a bit higher. At the moment it's sitting around 50, and we want it, I mean, ideally up to 80 would be good, but we'd be happy with any increase at this stage.
And it's quite a slow process, unfortunately, and that can pose a risk to the animal because the anaesthetic actually ends up being longer than ideal, which is a little bit nerve-wracking. But we really haven't got a choice if we want this animal to get back out into the wild. It's a risk that we're willing to take because he has a good prognosis.
Coming up, Patsy the echidna has a broken beak.
If it's all swollen, he can't sort of get his tongue out and eat properly. And that does concern me.
At the Byron Bay Wildlife Hospital, Ollie the pelican is undergoing critical surgery
A little bit nerve-wracking.
to stitch up a 30-centimetre gash to his feeding pouch.
It's a risk that we're willing to take because he has a good prognosis.
And despite earlier complications, our seabird is doing well.
Ollie has been a little bit difficult as a patient. Ollie has not wanted to stay under anaesthetic fantastically, but so far we're doing okay. We're getting there.
Yeah, it's looking so good since she done it
It
up.
looks amazing.
Thank you. The animal is being supported with fluids, and the girls are monitoring the anaesthetic. And he deserves every chance, really. If he was still out there with that wound, he would have ended up starving to death.
And it looks like Ollie's injury may have been caused by a fishing hook and line.
Australian Seabird Rescue have a motto of don't cut the line, which essentially means that if you're out fishing and you do get a bird or an animal entangled in your fishing line, don't just cut it and set them free. So always call for help and don't cut the line.
Oh, Hayley, can you start counting?
I can cite about 1 million.
1 million?
Okay, we're almost done this side. Almost done. Almost done. It's not cosmetic surgery. And we try to achieve, the best that we can do to get the animal back out there as soon as possible. Nearly there, my friend.
Looking good.
It all came together really nicely. Apart from the front, there was kind of a little bit of a wobbly sort of looking area, but the other pelicans aren't going to care about that. As long as he can feed and survive, that's all we're aiming for. Girls, get ready. This is the last suture.
Hooray! Okay, ready? Chop.
So you can turn off the anaesthetic and we can start waking him up. For Ollie, this was a really, really long procedure. I think he was under anaesthesia for about 3 hours. I think there were, close to 80 sutures, but everything went well in the end. I'm pretty happy with the results. Happy days.
Is that what I think it was?
The pelican waking up? Yes.
That's not what you thought it was.
That's a mammoth effort from the wildlife rescue team.
Tired, stiff, but good. Yeah, happy.
And a new chance at life for Ollie.
Come on, mister.
Hi, there we go.
No. He's had some post-operative pain relief. He's had a shot of antibiotics. And he will go home back to Australian Seabird Rescue tomorrow. Pop him in his recovery cage where he will stay overnight.
There we go.
And hopefully he'll sit like that for quite a while and continue to recover. And he'll be standing up in the morning.
Gonna have one happy pelican. He's very pretty, isn't he?
He's got a fair bit of life. Okay.
They bite really hard.
Yeah, treating wildlife is a lot different. You know, we don't get the cuddles, that, dog and cat vets get.
Ow, ow. I got bitten by the python.
They're wild animals, so they always want to bite you and do something just to get away from you because they're not used to being with humans.
So why have you got this tape around her beak here?
I'm sure we appreciate our 10 fingers.
Okay.
Anyone that knows brush towels know that they're pretty feisty.
I learned the hard way, they bite.
He must be really hungry to want to eat you.
But I suppose when they're trying to bite, ow, I know that they are feeling better. There's no milk in there, I'm sorry. Hello, little spiky one. Where can I go? Go in here, your little leg muscle.
A young echidna has returned to the wildlife hospital for a recheck on its beak.
A little sharp sting.
A quick sedative helps things go smoothly.
Okay, there you go. This echidna came in about 10 days ago after being hit by a car and had actually sustained a fracture to the beak. And it wasn't a bad fracture, but still, it's a fracture. And we want to see how it's healing. So today is to check on the actual fracture, see if there's a callus.
He looks pretty relaxed.
And then potentially organise the release of this echidna. So if it's healing well and the echidna is putting on weight and eating, we might be able to release it now.
The short-beaked echidna, found throughout Australia, is instantly recognised by its sharp spines and long snout. It uses its pointed beak and strong, sharp claws to dig for ants, termites and worms. It catches its prey by flicking its long tongue in and out. The echidna is toothless, using just its long, sticky tongue and pads on the roof of its mouth to break down food. They've been known to eat roughly 40,000 insects a day. It has few natural enemies, thanks to its spikes, but with a maximum speed of just over 2 kilometres an hour, being hit by a car is a common cause of death.
Snug.
Snug. And we can also see his snoot. If I'm not happy with how the fracture is looking, then we might say to the carer, keep it in for a little bit longer. All right, little one. Do you want to put him on the table? We can go like just... And then we're going to x-ray her again, see what's going on, and then make a plan from there. And so what we also need to do is see if this is a boy or a girl, because we haven't named it. We'll flip the echidna over and have a look and see if it's boy or girl, and then you, Miss Lou, can give it a name.
Oh, that's a lot of pressure.
Fluffy?
I don't know if it looks like a fluffy.
No, not Fluffy?
Echidna sexing is not as easy as it sounds.
You do it while they're in etherides because I feel bad, because you have to kind of sit there and manipulate it.
But Dr. Bree knows what she's looking for.
So echidnas have a 4-headed penis, so it's quite obvious when you get it out that it is a male. But I can't see anything. So I'm going to say this is a girl.
I'm glad that's sorted.
So what are we going to name it?
Oh, no. I think we should name her Patricia.
Patricia? How do you feel about this, Patricia?
Patsy, yeah, that's cute.
Patsy.
So Patsy it is. And it's on with her procedure.
X-ray.
So this is Patsy's x-rays today. You can see that we've got a little crack here on the top of the beak, and then we've got a corresponding swelling on the outside. And then we've got another fracture here with a corresponding swelling here, and then another fracture here. The fracture is still there, unfortunately. I'm not expecting it to magically go, but I would like to see some type of callus formation and some type of smoothing of the fractured ends. So this was the original x-ray, and then this is today's x-ray.
When Dr. Bree compares the two sets of x-rays,
Yeah, I'm not that happy with that one.
she sees that things may be actually getting worse for Patsy.
Yeah, I feel like it has maybe moved a bit more. the fractures aren't sort of smoothing over. They've actually moved just a little bit. So that tells me that Patsy is actually moving around a lot in her enclosure, and she is potentially bumping her nose on the sides, and that's why she's moving the fractured pieces around a little bit more. But these are the two ones that we really are concerned about because they're at the tip of the nose. They're where the nostrils, so the nostrils are sitting right here. And because they're swollen, they can actually impede her breathing. All right, we'll try and do a lateral and see what it looks like. Ready when you are, Miss Lou?
X-ray.
Okay, so that's that fracture. And then we've got our little fracture here. And that does concern me because if we have any changes to the bone structure there, that can impede their breathing later on. I'll have a feel of those and see how stable it feels. So both of his nostrils are open, but you can see that there's this swelling around there. And then also we don't want the fracture to impede into the oral cavity and stop him being able to poke his tongue out and actually get his food. So if we don't have a perfectly working beak, the animal can't get food. And then you add on the actual respiratory side of things, they can't breathe properly, so then they can't move around and they can't get out of the way, in time for a predator. We'll give it a bit of a clean. Get some nice warm salty water and give that a clean, and then I can have a look. We need to make sure that the beak is in tip-top working order before we release them, because we don't want to release an animal that could potentially go out there and not thrive. And that's the whole point of being a wildlife vet, is to get these animals out there to continue to thrive. I don't want to stop you breathing.
Coming up, Crash the Bandicoot is back for a checkup.
He was here last week and he was unfurred. He's now like a big kid.
But Dr. Bree is worried about his tummy.
There's a whole lot of gas in the intestines, so I am suspicious that he might be in the early stages of bloat. They're so cute.
They are cute.
At the Byron Bay Wildlife Hospital, Patsy the echidna is having her fractured beak assessed
There.
to see if she's ready to be released back into the wild.
You can see how little his mouth is. And so if they have a fracture, if it's all swollen, he can't sort of get his tongue out and eat properly. An echidna's beak is very important. It's a very slender, small organ, but that's their only way to get food. So these guys will eat like invertebrates, and so they'll eat sort of insects and grubs, and then they've got this really long tongue that they stick out to get their ants and their termites, and they have to then bring that back into their mouth to then swallow it, because it's really sensitive. And then you add on the actual respiratory side of things, they can't breathe properly. He has been digging here too, there's some injury.
Yeah.
Echidnas have been digging the earth for 20 to 50 million years.
I still don't understand, evolution is like, let's just cover this whole stuff with spines. But the most delicate part that either says you can live or die, pokes out here and has a really big blood supply and no spines to protect it.
The most common injury that we see in echidnas after they've been hit by a car is a fractured beak. Sometimes if they're quick enough, they can curl up into a ball to protect their beak, but a lot of times it's the first thing to be injured.
How cool is that X-ray? I do love echidna X-rays because it's amazing, what you can see and how to find their spikes are. And so these are just modified hair, but it's cool the structure that you see of them. You can see that they've got really thick scapulars and really reinforced shoulder girdles so they can dig. Patsy overall, clinically, is going well from as far as we can tell in care. The wildlife carer is happy that she's not too stressed, that she's eating and she's moving around well, so that's really good. However, when we look at the X-rays, we can see that the fracture isn't healed yet and it's actually a bit displaced. Potentially it might be 5% worse than when it first came in, and that's probably just because she's actually moving around, she's trying to find food. But I'm not comfortable in releasing her just yet. I just want to make sure that we give that beak a little bit more time to heal before we then release her.
She might be okay just to breathe room air, I reckon.
So she'll stay with a wildlife carer for a couple more weeks. She'll come back for another X-ray and then we can determine what her prognosis will be. Your tongue's out. So it is a bit of a wait and see game, and hopefully Patsy does the right thing and she relaxes, she doesn't bump her nose up against things, and she lets her body heal.
So it's looking like things might work out for little Patsy.
And then, of course, needs to do a big poo. You got to make sure all the systems work, right? It's always nice to see that the intestines are working. Everyone's got a poo. The kid has to do the same.
All right, Patsy, the carrot will come pick her up today.
Morning.
Hi, Rachel. How are you going?
Good, how are you?
Great, thank you.
So here's Franklin.
Franklin the eastern long-necked turtle lives at a wildlife sanctuary in the Byron Bay hinterland.
So we need to remove his sutures this morning.
Okay.
Yeah.
Head reptile keeper Rachel has been monitoring Franklin closely since he had surgery to remove a toe. And Dr. Shawnee has dropped in to check up on him.
I came to visit Franklin, the eastern long-necked turtle, just to have a look at a foot. He'd had surgery on that foot previously, and it was time for the stitches to come out.
The stitches might be ready to come out,
Hey, little one.
but Franklin isn't budging.
Oh, so he's gotten good at keeping these feet inside now.
Eastern long-necked turtles, they're incredibly strong animals. This could take a while. And once they have their head and their feet inside and under their shell, it is very difficult to extract those limbs.
Come on, buddy. Give me that foot.
Super strong, yeah.
What's going on, dude?
Okay.
Eventually, Franklin comes to the party,
Finally.
but there's nothing to celebrate.
Dear,
He's looking a bit manky.
I might have to take him back to the hospital with me.
So, having a look at Franklin's little foot here, and that's where the toe was amputated.
Yes.
It's looking like maybe the sutures have broken down a little bit, and maybe that toe is a little bit infected again. It appeared that the wound had actually broken down. This is not an uncommon situation with reptiles. They do take a long time to heal. Sometimes the wounds can become infected. Fair bit of dead tissue or necrotic tissue there.
Yep.
And I think it needs to be cleaned up properly, probably under a sedation, because it's probably quite painful. So as the wound had broken down, we needed to take him to the Byron Bay Wildlife Hospital and perform a clinical examination and see if we could resuture the wound. It's your time to shine, mate.
Yeah.
This next procedure couldn't be more important for Franklin. His life depends on it.
Unfortunately, there's only so much amputation or tissue that you can lose from a foot where it becomes an ethical issue for this animal. So we'll keep our fingers crossed and hope that Franklin pulls through this time. Hey, little one.
The eastern long-necked turtle spends most of its time in the water, but if they have to, they'll travel over land to new waterholes and nesting spots. They can walk up to 1 kilometre a day in their hunt for food. The eastern long-necked turtle feeds mainly on tadpoles, frogs, small fish and crayfish. They have incredibly strong jaws, but no teeth. So they clamp their food in their jaws, while their powerful clawed feet shred large food items.
Poor little Franklin.
Franklin the eastern long-necked turtle
Poor guy.
is undergoing surgery at the Byron Bay Wildlife Hospital in a bid to save his foot.
These guys really depend on their feet.
And his life.
We've really gotten to our limit of how far we can go without having to amputate other toes, and we really don't want to leave this animal with an amputated foot. That would not be fair. Wouldn't be able to do all his normal things. So we'll give this a shot, and if the same thing happens again, then we'll need to make a decision about the welfare of this animal. Come on, mister.
This is not Franklin's first visit to the wildlife hospital.
Diagnosis cutie.
But Dr. Shawnee is hoping it's his last.
The first surgery, the sutures have broken down. So I'm just going to clean it back up, and I'll probably have to amputate one of the digits in this foot.
Okay, so I think that's about as clean as I'm going to get that.
And there was one particular toe associated with that wound that looked a little bit suspicious. So we elected to remove that toe and debride a lot of the necrotic tissue away and see if we could get closure again over that area.
As you can see, a lot of this skin is very diseased already, and as I pull, it just breaks off, which is not a good sign. But all this swollen flesh needs to go, and I also need to take a little bit of bone as well.
A lot of the tissue was sort of macerated or quite fragile, so I had to really trim back a lot of that tissue to find some skin that was strong enough to hold the sutures.
The skin is just peeling off.
Oh, Franklin.
Franklin. I've had to debride a little further to try and get some healthy skin.
After a bit more debriding and a snip of the bone, Dr. Shoni ties off her first stitch.
Okay, first suture's in, and I'm pretty happy with that.
Excellent.
My mask is coming off every time I talk.
Do you want to undo your glasses? Yep. How's that?
Yep, that's good. Thank you.
Little Franklin's stitches appear to be taking.
Right, I think this will be the last suture, so...
And Dr. Shoni finishes up.
The operation went pretty well. It wasn't difficult to remove the bone. It's all held together. So I'm pretty happy with the way it went.
All right, Franklin.
That's the best I can do, darling. I think that looks better.
So now it's up to little Franklin to put his best foot forward in his new chance at life.
Good morning.
It's all about you.
Already seen over 1,000 patients, and that's only 8 months into our venture.
Hello.
Yeah, definitely very needed.
The sooner that you can get him in, the better.
Oh, bless him.
Hi, Steve.
Hello.
You've come to pick up Ollie.
We have come to pick up.
He's done really well overnight. We're very, very happy.
Ollie the Pelican is heading back to Australian Seabird Rescue to start his rehab.
The surgery went really well.
Following a marathon procedure to stitch up a tear in his pouch.
He's got multiple sutures.
It was a really, really long procedure. I think he was under anaesthesia for about 3 hours.
It's a little difficult to get it looking perfect, but we're not cosmetic surgeons. We're all about getting them back out there and getting him to survive. So he's eager to get out. All right, friend.
Ollie was most likely caught by a fishing hook and line.
I suspect it might have been hooked by a lure or something, and it's tried to take off, and the fisherman has tried to hold it, and it's ripped its spud. That's sort of my estimation, but we don't know.
Yep. Don't bash me. We're just going to give him a pain relief injection, and he's got some pain relief to go home with. He needs some feeding up too, Steve.
Okay.
His body condition's a little under.
Yep.
He's got quite a prominent keel there.
Should be hungry by now.
Yeah, I'd say so.
Okay. Cheers. Thanks for looking after him.
Bye, Ollie.
Behave yourself,
Good
please.
luck. Ollie should make a full recovery from the surgery.
Fresh air.
He will come back in for a few rechecks, and once being given the all clear by the vet, will be good to go back into the wild.
You're all right, mate.
Yeah, working with Byron Bay Wildlife Hospital is just amazing. Great people to work with. Yeah.
Good luck.
Yeah, without their help, we probably wouldn't save so many as we do. They're doing a great job. They're awesome.
Bye-bye.
Coming up.
Oh, that feels so good.
Ollie the pelican is flapping happy with his news.
You can go back home but stay out of mischief. Well done, gorgeous.
Some issues, so I thought we'd get ahead and just make sure everything's fine, and probably a little bit uncomfortable, so make sure he's doing okay.
So he was brought in last week after he and his mum accidentally got caught in a cat trap. And the mum just dropped him when they released her from the cat trap. And then so when he came in, yeah, he was unfurred. He's now like a big kid. And it is amazing to see how much he has grown. When we saw him not even 2 weeks ago, he was bald, eyes were closed, and he looked just like a proper baby bandicoot. But now, today, he's fully furred, his eyes are open, his teeth are coming through, and he's quite active. He just did a poo on my hand.
Hooray!
Reason that he's come in for his recheck, though, is that Maddie's not too happy with how he's feeding and toileting, which is not uncommon with some of our young marsupials. They have to contend with milk changes, being in care with humans, having lots of different things going on. And so tummy upsets are one of the common reasons we see these young marsupials in care.
I think maybe Maddie, we might need to feed him a bit more frequently at his age. Yeah. At 30 grams, they say feed 6 to 7 times a day.
Oh, okay. Is he still 30?
He's 33, so he's put on a few grams.
He went to 36.
And then went back down a bit.
So now he's coming back down.
Okay. Yeah. It might have been like the diarrhea as well.
Yeah. We're going to take some x-rays and see if there's anything serious that we have to be careful or we have to address. And hopefully it's something nice and easy that we can fix. However, bandicoots are known for getting a condition called bloat when they're in care, and we're not quite sure why they get it yet, but it is something that happens, and I'm hoping he doesn't have that. So we'll just quickly anaesthetise him, just make sure that there's nothing obvious. And then we'll give him fluids. And I think you're right, though, increasing his feeds, because he does look a bit scrawny still. He needs a little bit more meat on him. If it's possible, can we do a VD and a DV? Just I want to check if there's gas in his stomach and his spine and pelvis. I am a bit smitten. He's just so little, but it's just what I think I like about it is that he was here last week and he was unfurred. And he's like a big kid now.
Look at his little testes.
I know.
So small. X-ray.
There's a lot of gas in there.
Oh.
Needs to do a big fluff.
X-ray.
So what we can see here is that there's a whole lot of gas in the intestines, and so it's quite dilated. And that could be contributing to the fact that we're not toileting properly because you've got a lot of gas and it's actually not really letting the food go through properly. So that might be due to the feeding is maybe a bit too sparse. We need to feed more regularly so the tummy has more food going through and the peristalsis is a little bit more consistent. So I am suspicious that he might be in the early stages of bloat, unfortunately. We are going to give him some fluids, some anti-inflammatories, and then some medication to try and help move this gas along and get it out so he feels a bit more comfortable. It's a hard one, though, because he's so little, and we do have to be very careful now with him to ensure that we try and give him the best chances of surviving.
So hopefully all of this will help him feel a lot better and, yeah. It's away.
He did say, I think he tried to give him, but if you look at that
He looks very confused. Oh.
The little whiskey thing.
No, you've got to stay in your pouch.
Yeah, this is what he does every day. All right, so I'll send it all to you, but it won't be right now. But yeah. Maddie is one of our most dedicated carers that we have here up in the Northern Rivers. And with Crash, she has put in so much effort with this little bandicoot. She is really organising her time to make sure that this bandicoot gets everything that it needs so that it has the best chance of surviving. And we can't do our job without carers like Maddie, so we are very, very privileged to have someone like her helping us out. And what I'd like to do now is send him back to you, get him comfortable, and then maybe see him in a week's time and see how we go. Sure. Sounds like a plan?
Sadly, not every animal survives, in spite of the enormous efforts made by both staff and carers.
Crash passed away. Sorry. Yeah, he actually improved after being at the hospital. We put him on Infocol, which I think just started helping the gas move along. He was going to the toilet and gaining weight, so I was really hopeful. Yeah, things were looking really good, but yeah, unfortunately, he didn't make it. It's definitely the hard part. Yeah, I don't know what it was about Crash. He was a special one. Yeah.
All right, let's go grab Ollie because today's his day to go home.
Ollie the pelican has been recuperating at Australian Seabird Rescue.
That looks really amazing, yeah.
Following surgery to fix a massive tear to his pouch.
All come together and they'll just fall out by themselves.
Yeah, perfect.
A few days ago, Ollie went back to the Wildlife Hospital.
Thank you for coming to visit.
That's okay, Coolberry.
Where Dr. Bree checked him over.
And so this is a lot of suture in here, but it's looking really good so far.
And gave him the green light to be released.
You can go back home but stay out of mischief.
No promises.
No promises.
Sure.
Ollie the pelican is healing really well. So the actual suture, the surgery site looks beautiful, and it's a really good job of putting the two sides together. Well done, gorgeous. Well done. I'm happy for Ollie to go back out and be a wild bird again.
Let's go. Time to go, little Ollie. Just going to go to the edge of the wharf just here and send him on his way. With Ollie today, he is finally ready for release. Bye, little Ollie. After a couple of weeks in care, he's ready to go.
It's a big day for Ollie.
Sweet.
And for his rescuers.
Right. Yep. And just let him go. That's got to be the best feeling. Oh, there is absolutely no better feeling than seeing an animal go back out into the wild where it belongs.
Oh, the little tail wiggle.
Yay.
Oh.
And Ollie today, he just went out there and he shook his tail feathers, and so, yeah, that was a great feeling. Oh, he's having a drink.
Oh.
Looked at him straight back into it.
Like nothing ever happened.
Yeah, look, probably not waving goodbye, just kind of feeling himself again, getting a little more grounded, finding that balance as he goes back out into the water. But hey, maybe he did say goodbye. Maybe he's like, so long, thanks for the free fish, see you never. I wonder if he'll come visit us.
I hope so.
No, we'll be able to identify him. He's got those that nice big scar down his pouch there. The vets did an amazing job because they actually kept the majority of that pouch there, and that is so important for pelicans with their thermoregulation and all the things to do with mating as well. He's actually got a little bit of a unique pouch now, so hopefully that makes him stand out a little bit. Aww. How good is that? So good. Of course.